So please bear with us another 5 minutes and we'll get started. Thank you.
Hello everyone and welcome to this webinar. Thank you so much for joining us today. Hope you're all keeping well and finding ways to navigate these challenging times. We're really pleased to have you with us and I'm confident that today's session will be very helpful. It's a real pleasure to introduce our speaker, my colleague Dr. Ola Ahmed. Dr. Ola is the lead consultant clinical psychologist at Maudsley Health with extensive experience of working with young people. I'm sure you'll find her insights valuable, and thank you again for being here. Ola, over to you.
Thank you very much, Dr. Jack, for the kind introduction, and welcome everyone. I just want to start by saying appreciate these are difficult times we're all going through, and I think hence the importance of meeting to talk about topics like the one we're discussing today. But I think it's a credit to all of you to make time in your busy lives to come in and think about the children and young people that we care for and we support during this difficult time. We will have an opportunity to hopefully keep this sort of back and forth between us. So we will field some questions hopefully towards the end of the session today. So for the last 10 minutes, Dr. Jack and I will keep an eye on your questions in the chat. So please do interact, let us know your thoughts, reflections, questions, and we will protect some time at the end to come together as a group and think about those things. I want to say, so you all see that your mics and cameras are by default off, but we definitely are keen for you to interact and participate with us today. Obviously, we're talking about some difficult things, so please feel free to do what you need to look after yourself while we're making our way through this topic. And our team here are recording the session. And there are some links and resources and things that we will flag throughout, so you will have access to those things afterwards as well if you need them. So for today, we have lots to get through, but we want to start just by thinking a little bit about the current events that surround us and how these things might particularly impact neurodiverse children and young people or teens. Thinking about some of the signs that we might see that they have heightened support needs at the moment or need us to think about additional ways we can support them beyond the supports we always are providing. So we'll think together about some practical strategies that you can hopefully take away, or maybe just reinforce strategies that you're already using when supporting your child or young person. And I think it's really important that we end by thinking about ourselves as well, about yourself as a caregiver, as a teacher. How do we look after ourselves in order to look after the children in our care? So we know that the events of the last few weeks have been difficult for all of us. For some of us, this is the first time we've experienced something like this. For other people, you might have previous sort of lived experience of this level of uncertainty and stress and not knowing. But I think for a lot of us, it is the uncertainty of what comes next and how long things may be the way they are now, which can start to have an impact on our well-being. And of course, for all of us, this looks different. What we might feel in terms of different emotions will change potentially from moment to moment. It's different from one person to the next. I think it's just important to have space for that and be aware that we do react differently. And I think we can all relate to that, knowing that we felt different things over these last few weeks. We know, of course, that when it comes to children and young people, there may be some additional vulnerability. And we know that depending on a range of factors, their response to what's happening at the moment might also vary. So obviously, depending on the age of a child or a young person, we might see them impacted differently. A child's temperament, how they are in terms of how they've been since they were quite young. We know some children are more sensitive, more likely to experience big feelings, for example, just as part of their temperament and makeup. As I flagged, some of us and some of our children and young people might have experienced trauma, for example, or similar events to what's happening in the region at the moment. And as a result of that, might be responding differently to current events. As mental health clinicians, of course, what we're thinking a lot about is the vulnerability that might come with a history of mental health difficulties, depression, anxiety, other conditions that we might have been managing before any of this began. And of course, when we're thinking about children and young people, we're not just thinking about age, we're thinking about their developmental level. And today, of course, we're thinking specifically about neurodiversity and how that might, as a default, shapes how we might experience the world in general, and by extension, how we might experience difficult, uncertain events. So just in terms of definitions, so we're all on the same page, talking about neurodiversity today in a very broad sense. So that would capture children and young people who have additional needs or differences in terms of a range of domains or areas of functioning. So I'm not talking about a particular diagnosis today, although people are very welcome to mention specific diagnoses if they have questions for us at the end. But when we are talking about neurodiversity, we're talking about young people and children who have differences in their language and communication. So, at the moment, that could be particularly relevant in terms of how they're able to express their needs to us, share how they're feeling, or let us know that they're being impacted by what's happening. They might be young children or young people with differences in terms of their attention or concentration or executive functions more generally. So things like planning and organization, really importantly, maybe differences in how flexible we can be when things around us change. I think we can all imagine why that's particularly important at the moment, given how quickly things are changing around us. We might have children or young people who have differences in terms of their regulation, their ability to sort of manage their emotions, their behavior. So if we have a child, for example, with impulse control difficulties or in general difficulty managing big feelings without that spilling over into sort of behaviors that challenge. So these are all differences as a baseline, right, before the stress and uncertainty that we're experiencing at the moment. So really important to have this context when we're thinking about what we're doing to support at the moment. And of course, differences in terms of sensory processing, our kind of preferences, sensitivities to different sensory input, and learning. I think a lot of parents on the call today will be thinking about how the current context is impacting on their child's learning. And when we think about a child who has pre-existing differences in terms of their learning style, the amount of accommodation or support that they might naturally get at their school because of their neurodevelopmental differences, and how that then translates into online learning, they're all really big questions for lots of parents that we're speaking to at the moment. So I guess the point where we're thinking about here is, before all of the uncertainty that these last few weeks has brought, we know that these children and young people do have higher support needs, and we've been putting those supports in place. And as a parent, you find a particular set of strategies that works for your child. In the current context, it might be that we need to review those things and think about additional supports that they need as well. So again, we're talking in a very general sense about neurodiversity. So if we can make some generalizations here, we know that neurodiverse children often prefer predictable routines, clear expectations, and we know that they will often thrive in those environments because those things, the routines and the clear guidance on what's happening around them, that kind of scaffolding, we know can support emotional and behavioral functioning and help to make sense of what might be overwhelming or confusing aspects of the environment. And on that particular point, there's sort of familiar neuro-affirming environments, whether it's their classroom or another space outside of the home where your child spends time, where their needs are understood, their differences are understood, and hopefully met in a sensitive, positive, kind of affirming way. So we're holding in mind their differences, but also their strengths. So if we know that most neurodiverse children require these things, and then we think about what the current situation has brought about for most of us, we're thinking about changes in terms of distance learning and not being in school in the same way for most children. It might be changes at home as well. Parents who are now working from home or working under different conditions, so maybe not available over the weekends because you've been pulled into work yourself. New routines and practices that we all have to follow as part of the safety measures that the UAE has rolled out. So for a lot of children for whom routine and predictability is really important when we're having to respond to notifications or alarms and follow the guidance, these can all be new and particularly unsettling things for them to manage. And as I was saying before, with reduced access to, for example, the supports we get at school, but also other activities, extracurricular activities, social outlets that children would rely on, and perhaps on the flip side, more reliance on home-based things increased screen time, for example, is something we're hearing from a lot of parents at the moment, where maybe it's feeling that options are very limited at home in terms of how we support children, and we're relying more on things like screens and TV, which is both understandable, but also something that I think lots of parents are mindful of and keen to manage sensitively. So all of these changes, while I think we're all feeling them, I hope you're seeing that we know that this particular population of children and young people are likely to be particularly impacted by what's going on. So I think particularly when we think about communication and language differences, children with neurodiversity may not openly share that they're concerned or feeling unsettled or feeling anxious about what's going on, but there are likely to be signs if they are needing more support from us. So we might see, for example, changes in their eating or sleeping patterns. Lots of parents will be seeing bigger feelings like irritability and meltdowns, but reactions to things that might seem small on the surface. A child who is struggling to be flexible or go with the flow, or behaviorally just requiring more support day to day. And we think about learning, maybe a harder time with focus and concentration, and staying engaged with online learning. So while I think it's typical to think about behavior and behavior that challenges with a behavioral lens, I think what's really important is that we're able to take a step back and think about, what is this behavior communicating? What need is it signifying? So often, when we're seeing these changes listed here, it is a clear sign to us that what a child is able to manage, they're using their existing coping skills and resources, is not quite up to the demands of the situation at the moment. And that might change from moment to moment, but it's really important that we think not just of the behavior we see on the surface, but what is it communicating? What need is there that we can identify? Because that's a really useful place then for us to think about, what can we do? How can we help, right? So I'm keen to think a little bit with you now about some, again, broad stroke strategies and supports, things that hopefully you've already considered and might go away and consider differently. There's, I'm sure, a wealth of experience on the call today. It's great seeing such a big number of people with us here today. So I think it's important to say that neurodiversity, by definition, is about young people who present with very different strengths and interests and needs. So we have to tailor and apply skills to our child with the knowledge and expertise that each of you have for your child or your young person that you support. So I think when we start from a place of wanting to be curious, wanting to understand what is it that's going on for my child or teen in this moment, and using all of the knowledge you have about what works for them normally, is a great place to start when they're thinking about additional supports that we might need to offer right now. So I think that we have to start when thinking about supports with safety. I think for all of us at the moment, the uncertainty and the stress that we might be experiencing from moment to moment will come down to sort of a feeling of requiring a sense of safety, which is a fundamental human need, of course. We know that we are lucky to be in a place where the authorities have done a great job of keeping us safe, communicating clearly what's happening. And we, of course, advise everyone to stay up to date with information through official channels and using reliable sources. So we've listed a few of them here. I'm sure they're things you've all come across. So keeping up to date with what's happening around us and being in a position to know what's going on is really fundamental for our sense of safety, all of us. And from there, our job is to think about, how do we help pass on or instill that same sense of safety for our children. So as the trusted adult in their life, we understand that they will be looking to us for answers, to understand what's happening, gauging how they should be feeling or how they might respond based on how we're responding as well. But I think it's really important to know that none of us are going to have a perfect answer or always be in the space where we're able to give that sense of safety all the time. So we're not aiming for perfection, nor is that going to be a helpful expectation to have of ourselves as caregivers. But showing up and trying to be consistent and trying to use our normal parenting approach of connection and validation, all of those things are even more important when we're going through something like this. So providing information, just like we're using reliable sources to be up to date with what's happening, it's really important that we think about age appropriate and also developmentally appropriate information for our children. So talking to them about what's happening and being able to share information can be a really powerful way to give a sense of sort of containment and manage worry, right? So we know that young children can have, they'll fill in the gaps, their imagination will fill in the gaps if we don't speak about things openly. So I think some parents will say they have this urge to protect by keeping certain information away from children, but we know that it's not helpful to not talk about these things, right? And in the next slide, we'll talk a little bit about some guidance on how to talk about this. I think the key thing is we want our children to know that they're safe, that we have a plan, we're aware of what's happening, and collectively as adults around them, whether it's you as a parent, as a family member, as a teacher, and so on, as the authorities, that the adults around them are doing everything they can to keep them safe. So it is really important to talk about what's happening. We're a few weeks in now, and I'm sure for most of you, conversations have been happening at home about what's happening. But there's always room, and as things evolve, that we should be asking, checking in to find out what they know, what they're aware of. Particularly when we think about children who have access to social media and the internet. But even if they don't, they have access to peers and other people through online lessons and children who live around them. So they will absolutely be hearing about what is happening. So starting from a place of curiosity and asking what they already know can be a really good place to start. And it then gives you an idea as a parent about where you might need to clarify or offer information and what level to pitch your conversation at. Now, before I go through the points here, when we're talking about children with neurodevelopmental differences, one of the key areas of difference is often around language and communication. So as a parent or caregiver, you are going to know best how your child prefers to communicate, what level of expressive and receptive language they're at, what kinds of supports or visuals they might need to be able to access information about this topic or any other topic. So we have to start from that place of your knowledge of how to communicate with your child, what works. And from there, we want to think about how can we provide clear, accurate information that's tailored to their developmental level. I think there can be a tendency to want to minimize, maybe dismiss, or even say things that we feel might be protective for children, but actually aren't accurate. And we would really advise against this. So we can think about maybe information, certain points might be difficult for a child to understand or to process at this age. So again, this goes back to what is developmentally appropriate for them, but what we are sharing with them, we would really recommend that we're being clear and truthful in the information we share. This is really important in terms of the trust that we want children to have in us, right? So if I'm not sharing an accurate picture and they hear different information from different people, that can actually add to anxiety and fears for children. So giving accurate information is really key. But also we can sort of pace ourselves. So offer information in chunks, sort of pause and see how they're responding. Some children might sit quietly and sort of listen as we're talking. Other children might have lots of questions as we are sharing information with them. For some children, you might find that actually you get a sense that this is enough information for now and we need to come back to the conversation later. So it's really important to sort of chunk it up and see how they're responding to the information you're sharing. And yeah, offering a space for questions is super important, even if, and this can feel a little anxiety provoking as a parent or caregiver, we might not have all the answers, and we can be honest about that and say, well, I don't have an answer for that right now, but let me look into it and come back to you. I think that, again, that's a really important part of maintaining that trust with children. And this last point here about speaking when a child is or a young person is ready is really important. So, pressuring them into a conversation is not going to be conducive in terms of kind of that sense of emotional safety. You will know again when your child maybe needs space and time to think on their own and when it's okay to come back to a conversation. I think the key thing is we want them to know that these conversations are very welcome. They can come to us and express any feelings, concerns, ask any questions. So having that sense of safety that actually within our household or with this person that I trust, I can express anything without fear of upsetting them or saying the wrong thing. That is one of the most important things we can do for them at the moment. So there are a few examples here when we talk to parents about validating feelings. Sometimes parents need something a bit concrete. What does that look like? And it could be as simple as saying, "Thank you for telling me. That's an understandable way to feel. I also feel this way," right? So just being able to show them that we can hear this feeling, we can tolerate it. We're not trying to get rid of it or minimize it, and actually just to normalize that, yeah, we're all feeling a mix of different emotions at the moment. Now, again, with kind of communication differences in mind, depending on how your child or teen prefers to communicate, it might be that some visual supports are a really useful way to talk about these quite complex concepts. So some of you will already be using social stories or comic strips with the children in your care to try and explain everyday situations, but it's particularly useful with something as complex as this. So a social story, and there's lots of kind of variations on this out there, but essentially it's just a summary which uses simple language, very black and white, to help explain to a child or young person something that's happening or something that might happen, clarifying information or expectations. So if you think about anything that you would want to verbally share and you want your child or young person to be able to kind of come back to it and recall it, it might be that that's something useful to put together in the form of a social story. So just as an example, for anyone who's not using this sort of thing already, these resources that I'm going to show as some examples throughout the webinar, I've taken from a resource developed by the Autism Hub at the University of North Carolina, who've published some resources specifically around supporting children with autism, in this case, when they are in regions of the world impacted by conflict and uncertainty. So in this case, a social story might be in the form of a script like this, where we're talking about essentially feelings children might have in the situation, and again, normalizing that and maybe including some details around what they can do if they're feeling afraid. For younger children or children maybe with more significant support needs, cognitive and communication needs, a social story might look a little bit different and might include visuals, emojis, other images, photos perhaps, that help them to understand. So if we're putting together a social story about our sort of the safe space that we go to, and whenever there's a notification on our phones, we can take photos of the steps or the actual space that we'd be using within the home. And the important thing is when we put these things together to include children in them, rehearse them ahead of time. And maybe this is something, while this uncertainty prevails, something that we look back on a regular basis, just to review their understanding of the few key pieces of information that you think would be helpful for them. So just as an example, again, this is something we would individualize to each child, depending on what it is they needed support with. So we've spoken about the situation, we've tried to share information, and importantly, we've left the door open for more conversation, welcoming that ongoing conversation. Another key thing I think a lot of you will be thinking about is around how do we instill that sense of structure and routine in the life of our children, particularly if by default they thrive with that structure and with that sense of routine. Now, again, we're a few weeks in to online learning and to some of the other big changes that have happened in our lives. So I think naturally you'll probably be thinking about how your routine now does look a bit more like a routine. It's something that, naturally, I think human tendency is that we develop a bit of a routine even after some change has happened. But yeah, it might be worth reflecting on this and thinking, are there aspects of routines that within your households right now that could be different? Is there more structural routine that you could be offering, particularly if you feel like that's one of those things that might be unsettling at the moment for the children in your care? So we know structure in general, and not just for neurodiverse children, for all of us, can give a sense of predictability. So knowing what's happening next, and that alone can make a big difference when we're sitting with lots of difficult feelings, just knowing what's going to happen next, even if it's not necessarily something positive. So knowing that I have to move on to an activity I don't really enjoy can still give me a sense of control and emotional, it can be emotionally helpful. Routine and structure is also cognitively scaffolding, right? So it helps to give structure to my thoughts, to my day. And with that cognitive scaffolding is the sort of emotional scaffolding that comes with that as well. Reducing decision fatigue is a really important one. So, if we're all feeling a range of different feelings, by extension, we might be finding attention and concentration and our memory and our decision making and planning skills, they're all being tested a little bit more when we're not feeling our best psychologically. So anything we can do as part of setting a structure and a routine and making life seem clear and sort of systematic for children can help to overcome some of those challenges. And importantly, it gives that sense of emotional safety that we've been talking about. So a sense of not everything has changed. I know how things are going to be, at least for now, is a really important thing we can do to support. Now, in terms of routine, I really encourage you all to think about your existing daily activities for your child or teen that you're supporting. And can we include those things in a kind of more structured routine or build more of our routines around those things? Things like bedtime and meals, school times, whether it's sort of live lessons with school or homework time that we need to protect, and maybe other family routines that you have within your households. All of these things can sort of be emotional anchors throughout the day. So again, even if lots feels like it's changing and there's lots that's up in the air, having that knowledge that I wake up at a set time, I have my breakfast at a set time, I join my lessons and so on, can really help in terms of giving a sense of control and predictability amidst all of the uncertainty. So just as some examples, visual supports are something we know really help or a lot of neurodiverse children and young people benefit from. Obviously, again, these things would be tailored to their developmental level and their needs. So if we think about things like daily schedules, and it might be a checklist style like this where you tick off things as you complete them. For some children or teens, it might be something a bit more detailed, a timetable of their different commitments and appointments, and as well as these kind of routine everyday activities. We were talking about kind of helping reduce cognitive load and decision fatigue and things like that. So for some children and young people, visual schedules, even if we don't normally use them, but for activities that are multi-step, activities that maybe they don't really enjoy or they need a little bit more support and prompting from you, something that breaks down the steps of an activity can help again to just free up some of that cognitive capacity. So they've got a nice visual reminder of how to get through those steps. Because part of what we want as well is for children and young people to continue to feel a sense of independence and success in their daily activities as much as we can. And wherever possible, for all of us, when we're given choice and some autonomy over how our day goes, that's a really important part of feeling psychologically well. So if we think about choice boards like this particular example, might be a way to help remind my child or teen of things they can continue to do, even if life has changed in other ways. And allowing them, having that little visual reminder means we're not having to constantly sort of prompt them to think about what they could be doing, just having something they can come back to and have some choice over, right? So often there are aspects of the day where we might not have a real choice, so we have to join our online class, but we might have a choice in terms of where we sit at home to do the lesson, for example. So we can always think about, it's not always a choice to do an activity or not, but it could be a choice around how we do it or when we do it and those sorts of things. And I'd really advise, when we're setting up these things, if these are not already visuals that you use at home with your child or teen, include them in how you make them. For children who like to draw or are creative, they might actually help you physically put these things together, take the photos that are going to go into their visual, into their visual support. And we want to make sure we're including, meaningful, enjoyable activities so that these aren't just visual summaries of things that they dread, but they highlight the positive, enjoyable parts of the day as well. Okay, so we've spoken a lot about structure and routine. Of course, we all know that life happens and sometimes we have to deviate from the plan and we can't follow through on a particular routine. We know that that sudden change can be very unsettling, particularly if you're already feeling stressed and overwhelmed. So I'm sure a lot of you will know from your own experience, it can be really helpful, even if change is necessary, that we give advance notice of that change. Sometimes parents say, well, I want to give that advance notice, but I don't actually know how the plan is changing because it's evolving all the time. But even that we can warn a child of to say, we're not going to be able to go to the mall as we agreed. And I'm not quite sure when we're going to go next, but I've let them know that the plan that we had agreed had changed. And I've given them as much early warning of that as I can. Even if that doesn't feel like a satisfying thing to share, we know that most children would prefer that over a sudden last minute change to the plan, particularly a plan that they were looking forward to. And I think especially when so much of our children's lives might look different at the moment, they're not going to school, not seeing their friends, not being in the playground. I think a reminder of the fact that those things will come back at some point, but acknowledging that that is different at the moment. But also following that up with what can stay the same right now. So I think when we're talking to children about all the different changes, that can feel quite overwhelming. So making sure we're also reminding them that, okay, we're not going to school, but we can still talk to our friends online, or we're not able to go to our sports classes after school, but we can still play sport here together at home. So explaining what's different, but also what can stay the same. Okay, so once we thought about structure and routine, I think that can go a long way to supporting a child's emotional regulation. So their ability to kind of manage when big feelings inevitably come up for them. So, if we're thinking about emotion regulation, which is actually something we probably think about all the time with our neurodiverse children and young people, many of them will experience their emotions intensely and might need support and coaching to identify strategies to deal with those big feelings. So the foundation should be, and this is for all children, a sort of foundation of emotional literacy. So our understanding of our emotions, having words to describe our emotions, and also emotional safety. So knowing that we can express our emotions no matter what happens, our emotions are okay and accepted, even if we then need to follow that with conversations about behavioral choices and so on. But the emotions themselves are okay to feel and okay to express. So we do that at home through our daily interactions with our children. And right now, this is particularly important that we talk openly about feelings. And you can model that as a caregiver yourself by sharing how you're feeling, right? There's nothing more powerful than that for children. I can say that it's okay to express your feelings and you can tell me how you feel. But for a lot of children, it is hearing their parents or their caregivers share their own feelings that really encourages them to do the same. And we want to model and talk about the tricky feelings as well as the positive ones. So it's about normalizing all feelings, not just the ones that are easy to talk about. And just as we were talking with our kind of structure and our routines, if you already use particular visual aids, emotional thermometers, emotion wheels or charts to help your child identify how they feel or, rate the intensity of a feeling that they're having, this time is particularly important to use. So it might be that, we have some of these resources stuck on the fridge or tucked away somewhere because we haven't used them for a while. You might find that some children and teens need us to pull those things out now and make sure we have, if they require something visual and concrete to help them talk about their feelings, we absolutely should encourage that. So we've laid the foundation. We've tried to make things as emotionally safe as possible. We encourage them to talk about and express how they're feeling. Inevitably, though, we will find moments where big feelings arise, right? So in those moments, we know that it can be particularly helpful. But firstly, for us, we need to feel regulated ourselves as an adult before we can support a child that we care for. And that might just mean taking a deep breath or for some parents, depending on the day you've had or how you're feeling in the moment, that actually you need to step away and another adult needs to be the one supporting a child to regulate their feelings in that moment. So I think being kind to ourselves as well and realistic in terms of what we can do. But reducing demands in the moment. I have a child in front of me expressing a big feeling, feeling quite distressed or overwhelmed. I can reduce demands in various ways. It could just be reducing how much we say, right? For a lot of neurodiverse children, the more I talk and the more instructions I give, or the more I try to reason, the more overwhelmed they may feel. So either reducing how much we say, speaking more calmly, maybe stepping into a space where there aren't too many onlookers, siblings and other people watching as we're feeling really overwhelmed, can just reduce the pressure in that moment. And we try and slow things down, right? When things are fast paced, that they're escalating and I escalate and there's back and forth very quickly, it makes it much harder to make helpful choices in those moments. So slowing things down where we can. And as we said before, we want to try and look past the kind of the surface level behaviors, what they might be saying or how their body might be reacting in that moment, and try and understand what do they actually need here. And for most children, the priority, well, actually, in these moments, our priority is not to reason, to make sense, to learn from that particular moment. That will come later. What we want to do in that moment is help them to recognize that there's a big, strong feeling that they're experiencing and help them through that moment in a way that means we minimize any harm to them or to other people and actually teaches them some success in managing that feeling, right? So co-regulation. I can help a child understand that they're feeling really overwhelmed, but especially for neurodiverse children, they might really benefit from that extra step where I step in and I'm with them in that moment, and we're going to deal with this big wave of whatever it is they're feeling together, right? Now, again, you know your child well, and before all of the things that we've been experiencing started, I'm sure you discovered what works, what helps your child to regulate or calm down when they're feeling overwhelmed, and what doesn't. So this is very individual for different children. But if there is a big feeling in our body, we know there's a big physiological component. So doing something that involves movement can be really helpful, depending on what they prefer. Some deep breathing or diaphragmatic breathing can be very helpful as well. And I'll give some examples of that in a second. Identifying somewhere at home, either in their bedroom or somewhere else in the house, that's kind of our safe place we retreat to when we're feeling overwhelmed. And it's a good idea to put, preferred activities, a favorite book, a cuddly toy in that space. So it is a positive place we retreat to rather than a disciplinary sort of isolation place. So a nice place we can go to that almost is a physical signal of this is the place where I can feel my feeling. Grounding techniques are really important. And again, I'll give a few examples in a second, but I'm sure you have ideas of things that help your children feel a bit more grounded, present. And so what we're doing is sort of stepping out of or sort of observing feelings by connecting with the present moment as that big wave of the emotion passes, right? And because of the kind of sensory differences and preferences that a lot of neurodiverse children have, I'm sure whether it's through their occupational therapy or your own experience with your child, you'll understand how can we use the different sensory systems to help regulate. Deep pressure or really strong hugs, for example, could be really helpful for a particular child, really unhelpful for another. So your knowledge of what your child prefers from a sensory perspective is also really important. So one point I would make is that for some children, no matter how great or how extensive a list of tools, regulation tools we have, actually they might just respond best to some kind of redirection. So the best way for them to ride out that big wave of the emotion might be to offer a preferred activity, something that is really aligned with a special interest, for example, and the fact that this is something that naturally interests them and that they like to engage in can be the distraction or the alternative to fixating on a big, strong feeling and a strong kind of, or the unhelpful thoughts that might be coming with that feeling at the time. So that, in the short term, especially when we're dealing with something as difficult as what's happening now, there is no harm in using distraction if that is helping children to move past a very difficult moment. And as I was saying before, of course, we still want opportunities to learn from these moments. So once everyone's feeling calm and regulated, or the next opportunity we have to sit down and think, we can reflect on what happened, how they were feeling, and importantly, thinking about, okay, what can we learn from this? What helped? What did I do that helped? Or what did you do that helped? What didn't help you in that moment? So we almost have a plan for the next time they're feeling a similar feeling. So in terms of, say, grounding techniques, again, these are techniques that come from mindfulness principles. We know that mindfulness is the approach of sort of remaining present in the moment by noticing what's happening around us, noticing body cues. There's lots of scientific evidence around mindfulness techniques being really helpful for stress reduction. So, for example, a kind of almost a literal grounding technique around kind of planting our feet into the ground, or bringing our attention to, say, our breathing or any physical cues in our body. And for our young children or teens who respond to kind of visual supports, we might use something like this, a little visual of their feet or their feet in their favorite socks with a few steps on what to do to just bring their attention to the sensation of their feet against the ground for a moment. It can be really powerful. And I mentioned deep breathing. There are all sorts of different ways we can describe this to children, star breathing, in this case, dandelion breathing. They're all different sort of visual techniques, depending on what your child likes and is interested in, but essentially a way to prompt them to inhale, exhale deeply and slowly. And again, doing these things together. It's not a technique that they need to apply because they're feeling a particular way. It's actually something we can do jointly together, can make this a really positive, helpful thing for children and teens, of course. Um, I mean, a lot of you will have heard about kind of the five senses technique. We can bring our attention to the moment by thinking of five things we can see, and four things we can hear, and three things we can touch, and so on. You could simplify this for children depending on their developmental level. Something like, I can think about something I like to look at, something I like to smell, and so on. So a little visual like this, by the time we make our way through this, we've been mindful and present for a minute or two, can be really helpful for some children. And of course, we can come up with something unique to them. So, I know for lots of families, they have over the years devised a particular routine that suits their child and plays into their interests and their strengths. I just want to make a few quick points on adolescents. Obviously, everything we've discussed up until this point is relevant to adolescents as well, but we know that they have a particular tendency to withdraw and maybe shut down when they're feeling overwhelmed. So retreat to their room and maybe, as a result, engage more with friends and people online and so on. So efforts to keep open communication with adolescents is particularly important, right? And particularly in the current context, because we know they're likely to see all sorts of information online, some helpful, some unhelpful, some accurate, some not. So having them know that we are really keen to talk to them about these things, asking questions curiously and in a kind of supportive way. What are they seeing? Where are they seeing it? I think it's also really important that we can talk to them about the kind of local rules around sharing information online and making sure that they are using social media appropriately. And overall, finding a way, and this is difficult, even as in normal times, to encourage teens to have healthy limits around their screen time or their social media use. But I think if we are able to engage with them around the sort of pros and cons of how much time they're online, how is it impacting their well-being, and getting buy-in from them that actually, yeah, I need time away from all this information online, then that can be really helpful. I'm just mindful of the time and I'm just going to speed things up a touch. A few other quick suggestions. We want to encourage children and young people to participate in things they normally enjoy. We know a lot of neurodiverse children have particularly strong interest areas that they have lots of really important personal strengths. So this is an especially important time that they are engaging in those things. They may be creative activities for those that are creatively inclined. And connection is really important for all of us at the moment. In fact, we know that psychologically speaking, one of the biggest determinants of how we bounce back after times of difficulty and stress is social support. And this is for children as well as us as adults. So making sure they're connected with their friends, their loved ones, especially those that they don't get to see in person at the moment. So encouraging their peer support, interacting with their favorite friends from school, even if we need to do a little bit of scaffolding, they might not reach out and do that on their own, but we could encourage it. And even just connecting and doing things together as a family at home, cooking together, playing a board game, doing a movie night, whatever works for your family. Now, I really don't want to rush this point because it's probably the most important thing we're talking about today. We are all human. We're all going through the same thing that our children and young people are going through. And we know that, I'm sure you've all heard the oxygen mask analogy, that we have to look after ourselves before we can be in a position to help anyone else. So if you're thinking about all the things we said today, um, psychological and emotional safety and routine and predictability and managing our feelings. So just like we want to help our children with these things, we need to be doing the same for ourselves. And that might be checking in with yourself, but also reaching out and like utilizing your support people, whether it's your family or your friends or whoever it is that you're able to sort of share the burden of things with. So making sure we do all of that, thinking about aspects in your life that you can control as well, right? There is lots of things at the moment that might feel out of our control collectively, but there's always aspects of our day-to-day life where we can feel that sense of control. And this is probably the most important thing. I talk to parents every day where they're feeling the pressure of keeping things completely normal for their children, trying to protect their children from any of the negative emotions that they might be experiencing at the moment. And I think we have to be kind to ourselves and realistic that these are not normal circumstances. Of course, this is hard. It's hard for all of us. And actually, what our children need from us is not that we're perfect. So, if we have a day where we lose our cool or, where we didn't respond in the kind of attuned, sensitive way we wanted to, that we can come back and repair that, right? So under normal circumstances, no one is a perfect parent, but actually children don't need that perfection from us, right? So be kind to yourself. I think if that's it, the one thing you take away from today, I'd be happy with that. So some takeaways then, or to summarize. Neurodiverse children in particular might appear more vulnerable at the moment and need more support than normal. Communicating and doing that in a way that works for their communication style is really important. Thinking about structures and routines that work for now and being practical about what we can and can't do within our routines right now. Being compassionate and sensitive to their behavior. So looking beyond the behavior and thinking about what are they telling me, and supporting their big feelings are all really key things. And yeah, I just want to emphasize that point. Small changes can actually make a really big difference for children. So if you go away from today thinking about one or two things that you might do differently, or maybe one or two things that you've heard that you think, yep, this works well for me, and I'm just going to focus on being consistent with these things, I think that can make a big difference. Okay, and yes, of course, we can do all of this great work to support our children and young people. And if you feel that actually more support is needed, so if life day to day is still feeling significantly affected, if, children after a period of time have not sort of returned to their baseline in terms of their emotional functioning, or if you personally as a parent or a caregiver feel you need more help, please don't hesitate to reach out to whoever that might be. So you'll have access to contact details for us. If we can be of any support, please do reach out. And we'll also have some links to different resources that we've spoken about today and others that might be helpful to check out. So I just want to acknowledge that a lot of the information covered today was information pulled together by my wonderful colleagues here, Dr. Charlotte, Dr. Sophie, Professor David, and Dr. Shoshana as well from Beacon House. So just wanted to acknowledge that and thank you very much. So Dr. Jack, I think thank you all for your reactions. I'm seeing your kind of emoticons and thumbs up and hearts as we go throughout. I wonder, I have lots going on my screen, so I haven't been able to, yes, so just on the links will absolutely be shared. So hopefully you'll be able to access those. Do we have particular questions that you can go through?
So far, the only question has been addressed in the chat by Robin, just about whether there will be any additional webinars or sessions for parents or caregivers that may have other themes. So please do follow our social media channels, which are being shared right now.
Yes.
And Aisha has just shared a link to another seminar or webinar that's happening this week. To a few different ones,
Yes.
actually.
Yeah, and we're definitely keen to be engaging with the community and having those open lines of communication with you all. So yes, please join other webinars, reach out if that would be helpful. But we've really appreciated your attendance today. We do have time if anyone has any questions or reflections. Yeah, so maybe Robin can answer just in terms of people accessing the links, how that's going to be possible. So the recording of the webinar will be available on YouTube. And in terms of, I'm sure Robin will be on the chat to answer that particular question. But yes, we definitely want everyone to be able to access the links. I can see all of your messages coming in and you're all very welcome. We're really glad that you could join us today. Thank you. We appreciate your feedback. And actually I should have maybe stopped at the next screen. We welcome your feedback, whether it's about the webinar today or about other topics that you would like covered. Be very happy to hear from you about what would be helpful. Jack, I'm not missing any questions, right? You're seeing them on your end as well?
Keeping an eye on it, yeah. Just lots of thanks for today.
Yeah, well, it's our pleasure. Okay. So perhaps we'll call it for the day then. Thank you all again very much for joining Jack and myself, and we look forward to having you with us in future webinars. Everyone keep safe, each other, take care. Okay, all the best.